So next, we're going to have a little discussion here about student research and how to get involved. So I'd like to welcome here Professor Demerath and recent MPH maternal and child health alum Ghazalehh, and they're going to talk to us about student research. Yeah, so why don't we just start with introducing yourself and a little bit about your background.
Okay, can you hear me? Okay, great. So my name's Ellen Demerath. I'm a professor in the Division of Epidemiology and Community Health. I'm also the program director for the Maternal Child Health MPH program. And I serve as an advisor for a number of different programs, the EPI program, MCH program, and also public health nutrition. I have a broad background. I actually come to public health from anthropology, which is a very broad field studying the interaction of people, their biologies, and their environments and cultures. And I thought it was a great way to sort of get into this field. And my area of specific research is in maternal and infant nutrition. So I study predominantly obesity, but how that obesity arises very early in life from the way mothers are eating and exercising and how those infants are fed and grow. So that's me.
Ghazalehh.
Hi, I'm Ghazalehh, and I just graduated with my MPH. And like Ellen, I have actually a background in anthropology, and I studied social anthropology for undergrad. And then my life took a completely separate path where I actually did a little bit of finance work, accounting work, and then finally when I ended up at the School of Public Health, I knew exactly where I wanted to go, and that was as a result of my personal experience with childbirth. So that is what brought me here, and I went in thinking that I was going to have a wonderful natural birth, and about 2 days later, I came out with a baby that I had through a C-section. And that never sat well with me, so I needed to know the root and the cause of that, and that's how I came to it. Throughout the journey, I found out that, you know what, it is not that easy to actually do the exact research that you are really have in the background of your mind to do, but you sort of need to explore and also expand your horizons, and that is how I came to work with Dr. Demerath.
Okay, perhaps this is a question for you, Professor Demerath, regarding student research with respect to master students and also PhD. So it's obvious for a PhD, but can you also comment if you've worked with master students and the types of projects that they've been involved with? Besides, of course, the obvious example.
Of course, yeah. So, the PhD programs all require that you'll be writing a dissertation. So there's in that program, there's no doubt you're going to be doing lots of research and writing with your advisor and other faculty members. It's required, right? But actually, our MPH programs also have many opportunities for research, and we strongly encourage you to take those advantages on. Dr. Osterholm was talking about how don't learn facts, and I think that that's something that maybe in the mid-century in public health we sort of got to this point where we know that smoking is dangerous, and so there's campaigns for non-smoking, for quitting smoking, or we knew the hygiene movement told us that we needed to have fresh and clean running water, etc. But everything changes all the time. So the research that we had even as recently as the 2000s on a topic is probably out of date. So if you're learning about what's best practices today, that will not necessarily be best practice in 5 years. That's how fast we are changing. We're changing in terms of our populations, right? We're aging, we're becoming more diverse. The world is more mobile. We are moving around and connecting with each other much more quickly than ever before. So there's this acceleration. There's changes in technologies that are tools for us in public health, mobile devices and others, and the internet, et cetera, that allow us to get into people's lives. But there also can be the sources of some negative exposures. So the world is changing, and that's why Dr. Osterholm said, don't think about this as learning facts. This is about learning how to learn as well. And I think that taking advantage of a research opportunity with your advisor, be it a PhD advisor, of course, but in the master's program as well, take advantage of that. You may not think that you're going to be the person who's writing the research papers, but you have to know how to read those research papers. You have to know how to critique them. You have to know how to glean from them what the most important outcomes were from that paper and decide for yourself whether you, as a public health leader, are going to take this approach or that approach. This program has been shown to be effective or not, or this intervention sits well with the Somali population or doesn't, that kind of thing. And unless you have that training, you're not going to be the leader that we need. So I think that even though many people say to themselves, and I've heard this from my master's students, that, well, I don't really need to know about the science, the scientific aspect. That's not my job. It's all of our job to know the science, because that's how we lead. So as far as how to do that, I would say that you need to go and find professors that you are interested in their work. I mean, we're all on the website, and you're going to be meeting all of us in class. Do not be shy. Be bold. We like students. We actually like it when you come up to us and say, that's really cool. How can I be involved? Okay? So we like that, and we want that, and so don't be shy. So that's what happened, I think, with Ghazalehh. She was in my class. And I don't know if you want to talk about that at all, but yeah, for sure. Master's as well as PhD.
I'd also like to second that as a member of the biostatistics, I also like students, so this is not just your area. So you want to add to that?
So yeah, I actually approached Dr. Demerath at the time that I was really starting to get worried, because I had to do my culminating experience, and I didn't find I hadn't found the right path to sort of approach it. And because of that, one day after class, I was taking a genetics class with her, and after class, I basically approached her and I said, you know what, I'm looking for a data set and I need to start doing my research on it. Do you have anything that I can work with? And she was very welcoming. We talked about a few different projects, some that were still in very early stages of infancy, and there was no way that we could get it together for a culminating experience. But some other work that I had already gone to the extent of publication, so that wasn't going to work either. But within the research that she was doing, there was data sets that we found, and we started working on it and sort of moulding it into what we wanted it to be. And it turned out to be a great working experience for me. And that is actually one of the things that we really need to do. I mean, I approached a couple of other professors, and admittedly, they were either outside of the division where I needed to do my culminating experience, and they told me that. But it was a matter of actually approaching the people and learning whether or not it was something that we could work on. And I'm very grateful that it worked out with Ellen.
Yeah. So to follow up on that, I think one of the challenges, especially if you're coming from a bachelor's program, is getting started with the research. So do you have any thoughts on any advice you would give if these students come from that background?
You know what? You need to be open to it. It's really about how much you're willing to stretch your level of knowledge and how much you're willing to learn. And I think that the culminating experience was the one area where I actually not only applied all of the skills that I had learned through the epidemiology courses that I had taken, but I had to think independently about it, and I had to come up with the ways to be able to actually form the research and the paper into a shape that was both understandable to me and also something that was presentable to not only a community at the university, but also taking it beyond and thinking about, is this something that we can actually go ahead and publish?
Yeah. I mean, that's our goal. In the master's programs, our goal is to have you have a publishable paper for your culminating experience. Now, some of the programs don't require that, or it's not a requirement that the paper is published. But we're a research institution here at the University of Minnesota. I mean, you are in a very high-powered and high-status institution in public health. We're not here to just do same old. We are leading the field in our various areas of research, and we want you to be involved in that and have that experience of working with a faculty member, working on data sets, or working with projects that don't involve quantitative data is fine. Also, many of our programs are more in the areas of policy analysis But nonetheless, it's about research and impact. So we definitely encourage you to get involved.
So another question related to this, don't mind if you don't want to answer this. So one of the things that's difficult with research is that you're going to encounter a lot of failures. And it's gonna happen. Do you want to give an anecdotal, anecdote on that, or maybe just a broad comment regarding failures and overcoming them?
I think actually one of the things with ongoing research is the fact that you don't already know all of the facts, and you still have to sort of dig and delve and be willing to do that over and over again. An anecdote that I can give is actually one of Ellen's students who had a research project who has actually presented it for her master's project. Yet the paper was actually not at a point where it could be published, and we are actually going to rework that paper and basically get the data, culminate the extra data that has been collected since, and basically get that into a publishable paper. So that is one of the things that I actually have the privilege of working on right now with Ellen, even post-graduation.
Yeah, that's right. I mean, you can't be sure, right? If we knew the answer, it wouldn't be research. So your hypothesis can be wrong, but that's a learning experience too. I don't think there's any, thing that is a warning here. I mean, I think that just being involved in the process is the most important thing, and learning about that. Yeah.
So I'd like to open the floor up to any questions for these two. Does anyone have any questions? So the question is, can you please comment on time commitment with respect to research?
Well, the way I approached my culminating experience actually was that it was a 2-hour course, but really that's not what you're going to get into. If you had a cleaned up preset data set that came from one of the big institutions, for example, if you were working with something from PRAMS or something from CDC, and those are all secondary research that you can do, and it might be actually a lot easier to actually gather it all up together. But to actually do an actual paper where you are going to research it and analyze it and do all of the writing yourself, I would say that it's a good 4 to 5 hour course that you need to work on.
Meaning spending 10 hours a week, 15 hours a week.
A bare minimum.
But the way we structure the programs generally, at least I can speak from EPI, is that most of that work is in your final spring of your second year. And you have credit for that. But, it's also a personal journey, and you're learning. And sometimes it takes more than exactly 5 hours a week to learn something. And I think we all expect that.
Yeah, one of the courses actually in epidemiology that I'm aware of, because I actually was an epi minor and I had to do that, was a course that helps you form your culminating experience, and that was extremely helpful. And I think all students in EPI have access to that course, and it is a part of the requirements, as far as I understand, for doing your culminating experience. So take advantage of that. That actually helps to bring the paper at least into a shape where you can work with your advisor on your project and basically make it presentable.
And one other I just wanted to say is that if you have an opportunity to network with those that are working in the field, in our programs in epidemiology and probably others, there's a field experience requirement for many of the master's programs. And that is really useful, because what you're doing is you're going out into the field, and some of the work you're doing may be programmatic in nature, but often those places have their hands and their fingers in very important data sets at the state level, the federal level. And when you're able to get in with those people, they are going to have tons of work that needs to get done, and they need hands on the wheel. And so you're going to have an opportunity to get into that, and then you can bring that project and make that part of your culminating experience. So it's not only what the faculty here are doing, but we have a great network out in the communities and the county level and the state level here that'll help you get your hands on data or projects.
And I could actually speak to that before, because I did my field experience at MDH, and actually worked with a great data set that allowed me to basically do a cost-benefit analysis, something that was actually a little bit more close to what I knew from my previous work that I had done, but also it required a lot of epidemiologic skills to be incorporated into it, and also to actually understand that it was important research to be done, that the people at the state level have the data set, yet it has not been tapped into, and to just have that opportunity to work on that.
And I'd also like to add to that. So one of the projects that I gave to one of my master's students, I got him hooked up to one of my collaborators in England. And so it's not just local or national level, but this could also be on an international scale. A lot of people here have a lot of connections, and so it's a matter of just seeing what's out there and what you can get connected with. Any other questions? Yeah. We don't have a mic going. I'll repeat your question. To repeat the question, this is for those who are involved in distance learning and how you can get involved when it comes to research, in particular getting connected with the researchers here.
And I welcome if there's any faculty that have actually more experience with this than I to chime up. In our MCH program, we actually have a whole online program where people from around the world are in the program, and so they are distance. I mean, one of my advisees was living in Tanzania the entire time she was in the program, and so she had actually a lot of opportunities where she was to work with programs that she wasn't already with. I mean, the field experiences and that kind of thing. I mean, we want you to grow. So if you're already sort of in the field somewhere, that's great. That'll give you lots of opportunities. You'll know people on the ground, but we want you to grow. So it can't just be sort of do the same research you've already been working on. You're going to branch out. You're going to find a new preceptor and have someone else that's going to give you a new insight. That's no problem. We are here to help. I mean, we as advisors are going to help you. We're going to be able to support you, give you some, ideas. Oh, maybe go this way or that way with it. But it's very flexible. I would say most of us have very flexible programs. So, but yeah, is there anyone else that has more details on that?
I actually thought about one of the students from our cohort who actually was a supervisor at MDH, but what she did was basically take another role as with a preceptor for her field experience in a different department, and that is both growth and also like being within the same work place that she is already at. So that was one of the things.
Yep. Any other questions? Yep. So to repeat that question, is the research restricted to just culminating experience, or can it branch out to other areas? Is that correct? Yeah. So.
Oh yeah, I was sort of perseverating there maybe on the culminating experience, just because I know for master's students anyway, which is the majority of the people in the room, that's sort of a time that's like a sacred time that you can have focused on that, if you wish. But no, absolutely not. I mean, we have students working with us, from the get-go. I mean, if you're interested in your first year, absolutely, go for it. I mean, there may be RA-ships, or there may be just learning along the side. I don't know. We can't. Not everyone will have an RA-ship that'll be supporting their time, but there will be opportunities, and I think it's. I can't emphasize enough that, we as faculty we also don't know what everyone else does. It's a very large school, and our divisions are also large. And so I feel sometimes that I want to say that, just not because I'm trying to get myself off the hook, but no one faculty member knows everything that's going on. And so if it's kind of up to you guys to say, I like this, and sort of find some people. Ask your advisor. They may have a great number of people to tell you about, but if they don't, that doesn't mean it doesn't exist. I would say anything you're interested in here at the school is probably going to be able to be done. So yeah, no, it's not just culminating experience. It could be throughout the program if you wish.
Actually, can you repeat the question?
Okay, so the question I think had to do with whether your culminating experience research could be a continuation of work that you were doing sort of earlier in the program. Yeah, and actually we encourage that. That's no problem whatsoever, except a culminating experience can be in the division. It's the field experience where we make sure that you are getting out of the ivory tower and into agencies and settings outside the institution of the university.
So to repeat your question, this is with respect to those with zero experience in research, and if they are, can you repeat the last bit? Is it? Okay, so it's in some sense it's how we treat those with or without prior research experience.
Yeah.
Do we encourage them in the same way as those with prior research experience, and how they're treated, whether or not they're treated differently or not?
Yeah.
Okay, and so the follow-up to that will be the expansion for those without research experience, if they will have further opportunities to expand what they've done. So either of you want to comment on that?
Well, I mean, we take everybody where they are, and so some who already have research experience can probably get right into a program and already have some skills that are useful. I'm thinking analytics skills, but other skills as well, community partnership skills, communication skills, policy skills, whatever you have and you can bring to the table. So I wouldn't say that, I mean, I think every student here, the reason you're here is because you actually have skills, and it's about shaping them to what we're doing here. So nobody's a blank slate. But if there are particular skills that you don't have, then that's what, we as advisors and teachers are here to give you. So, I mean, we're not trying to say you already have to be researchers. What we're trying to say is this is an incubator for forming researchers and developing existing researchers. So yes, I mean, it's both. New and existing researchers are welcome.
Yeah, to add to that, to give you an example, so my first PhD student, so he's currently working on analyzing brain images. He has no idea, how to do that, but, I got him involved. And so he's, we started with, this is the brain. So, we meet you where you're at. Yeah. Do you want to add to that, or you're good? Okay. So maybe one more question.
This is a programmatic question more than a research question, which is, if you are already in an agency working, do you have to find a different agency to do your field experience in? And I think on average what we kind of want to say is yes, but I think if it's within the same agency but a very different area or skill set, that's probably going to be okay. I mean, we're here to support your learning, right? I mean, we're not here to to be putting up barriers.
Right.
But that being said, what you do for the field experience is all, there's a contract, you find a preceptor who has an MPH at least in your desired setting, and then you draw up a program of objectives and activities that will support those objectives for learning for 90 or 120 hours. And and it's all about negotiating that and figuring what will work for you, your preceptor, your advisor, and your program head. And they all have to kind of sign off on it. So I don't want to get too much in the weeds on those specificities, partly because I can't speak for all programs. Right. But if it were my program, I mean, I think that we try to work with you. We just want to make sure that you're getting out and getting new skills and not just sitting where you're sitting.
Yeah. Okay, so let's thank Professor Demerath and Ghazalehh. So.